Welcome, and thank you for joining me today at the ISICEM meeting. Today, I'm going to talk about what's happening with vitamin C for the treatment of sepsis. I'm grateful for the organizing committee for inviting me. I'm Greg Martin, a professor of pulmonary and critical care medicine at Emory University in Atlanta, and the president-elect for the Society of Critical Care Medicine. I conduct research in patients with sepsis and ARDS, and now also in COVID-19. And relative to this talk, I have a conflict specifically related to vitamin C, one of the studies that we've been doing, which is the Victus trial funded by the Marcus Foundation. So today we're going to talk about three things. We're going to talk about the background knowledge we have about vitamin C in patients with clinical sepsis. We're going to talk about the rationale and biological roles for vitamin C, for thiamine, and for hydrocortisone individually and together in treating sepsis. And then finally, we'll discuss the current clinical evidence, of which there's been quite a lot in the last few months, emerging about clinical studies and clinical trials in the treatment of sepsis. So you all may recall that this discussion really began with the publication of a single institution's experience with integrating the three-drug treatment cocktail, the use of vitamin C, thiamine, and hydrocortisone together into their sepsis treatment protocol. And when they analyzed and compared the data from after that was done and the outcomes for those patients and compared it to the outcomes for the patients before that change, they noticed a substantial reduction in mortality. So the question arose whether that mortality difference was potentially due to the drugs or was it due to something else that changed over the same time period. So if we start and think about why we may use these medications, we want to start first with the biological rationale. And we do know quite a bit about vitamin C, for instance. We do know that subnormal vitamin C levels are quite common in critically ill patients, but particularly they're a constant feature in patients with sepsis. But we also know that vitamin C levels themselves, ascorbic acid levels, correlate inversely with organ dysfunction and with mortality. So lower levels of vitamin C are correlated with higher numbers of failed organs and with higher mortality. Now, if you think about the three drugs together, there's several different features. So for instance, thiamine is involved in aerobic metabolism and with lactate formation, whereas ascorbic acid or vitamin C, we know is an antioxidant, it's a scavenger of free radicals, but it's also a cofactor in the production of vasoactive substances like dopamine and norepinephrine. And finally, glucocorticoids or corticosteroids are these pleiotropic, broadly based medications that are generally considered to have an anti-inflammatory effect across a range of activities. So one of the first studies, at least in the contemporary era of vitamin C in sepsis, actually began with a small phase 1 study of 24 critically ill sepsis patients with organ dysfunction. And these patients were randomized to receive either a moderately high dose or a higher dose, 50 milligrams per kilogram per day, or 200 milligrams per kilogram per day, of intravenous vitamin C compared to a placebo. And what the investigators observed is not surprising that the levels of vitamin C or ascorbate went up. You see that in the top panel. But then what they also saw was a reduction in organ dysfunction, a reduction in SOFA score that was not only consistent over time, but it also seemed to be dose dependent. The patients in the higher group had a greater reduction in SOFA score than the patients in the lower dose group. And there was no reduction in the patients who didn't get the treatment. So this study was then followed up in a study that's called the Citrus ALI study that was published last year in JAMA. This study was in sepsis-induced ARDS patients. So in this case, there were 167 patients who were randomized to receive the higher dose of vitamin C, 200 milligrams per kilogram per day, or placebo for a 4-day treatment period. And what the investigators found was no difference in SOFA score, and in fact, also no difference in biological parameters or biomarkers. But they did see a reduction in mortality at 28 days, a significant reduction that was accompanied by a reduction in ICU-free days, or an increase or an improvement in ICU-free days. So about 3 more days alive and free of the ICU, and a suggestion that perhaps ARDS may have been resolving more quickly, not statistically so, but ventilator-free days were about 2.5 days greater in the treatment group than the placebo group. So there's several other studies that have looked at vitamin C. And in fact, there's a systematic review or several now that have looked at the role of vitamin C in different populations of critically ill patients. So here's an example that's specifically asking the question about the use of vitamin C and the duration of mechanical ventilation. This is a review of 685 patients from 8 studies. And the key to this is actually the fact that there's a lot of heterogeneity between these studies. And in fact, the review did not require that randomization have occurred or even that a control group was present in the study. Having said that, what they found is a suggestion that there may be a shorter time on mechanical ventilation for the patients who receive vitamin C. So about a 14% reduction in the duration of mechanical ventilation. And that difference seemed to be greater in the more severely ill patients or those who had the longer mechanical ventilation. When we jump forward to the contemporary era, and particularly beginning to look at the combination of medications, vitamin C and thiamine together, one of the earlier studies was an observational study out of South Korea, where they examined 229 septic shock patients who received the two medications, compared them to 915 septic shock patients who did not receive the treatment. And overall, they found no difference in mortality. But in exploring the data, they suggested that perhaps if an effect were to be seen, it may be seen in those patients with lower albumin or in the more severely ill patients with the higher SOFA score, a SOFA score over 10. So jumping forward then, we've seen a lot of clinical trials that have now been conducted, particularly to follow up some of the earlier observations and to study both mortality, organ dysfunction, and SOFA score over time. So one of those is the HIVICTA study. The HIVICTA study was published in Chest, conducted in China, with 80 sepsis and septic shock patients who were randomized to receive the single-blind administration of vitamin C at a dose of 1.5 grams every 6 hours, thiamine 200 milligrams every 12 hours, and hydrocortisone 50 milligrams every 6 hours. And in this study, there was no difference in mortality at 28 days. They did suggest that perhaps in the subgroup of patients who were diagnosed earlier after ICU admission, diagnosed earlier with sepsis, that the treatment may have been effective. There was a reduction in mortality in that subgroup. They also noted that there was more hypernatremia in the treatment group. But the thing that they did notice is actually a substantial reduction and a greater reduction in SOFA score. So again, looking at SOFA out at 72 hours and measuring it, using it as a measure of organ dysfunction, there was about a 3 and a 3.5 point reduction in SOFA score in the treatment group that was larger or greater than it was in the control group. Another study was comparing simply ascorbic acid and thiamine, the ATEST study that was conducted in South Korea. This is a study of 111 septic shock patients who were randomized to vitamin C 50 milligrams per kilogram every 12 hours and thiamine 200 milligrams every 12 hours. In this study, they found no difference in SOFA score, no difference in mortality, also no difference in acute kidney injury or ventilator-free days or shock reversal, and also in this case, no difference in SOFA score. So the SOFA score declined in both groups, but there was no difference between the two groups. So in fact, the decline was very similar between both the treatment and the control groups. More recently, there was a study out of the United States, the Oranges study, which studied 137 critically ill sepsis or septic shock patients using a very similar regimen, vitamin C 1.5 grams every 6 hours, thiamine 200 milligrams every 12 hours, and hydrocortisone 50 milligrams every 6 hours. And in this study, they actually found a significant reduction in the duration of shock. So the duration of vasopressor infusion was 27 hours in the treatment group and nearly twice as much at 53 hours in the placebo group. So a significant time that you see in the graph in the lower right, showing a more rapid resolution of shock or a more rapid removal of vasopressors in the patients who receive vitamin C with thiamine and corticosteroids. That was greater than the patients who received steroids alone and greater than the patients who received all three placebos. They also did not find any difference in SOFA score, which you see in the top right. The SOFA score declined in both groups, but not any different between the two groups. Another study that was conducted and published recently out of Australia, New Zealand, and Brazil is the vitamin study. This study studied 211 septic shock patients and randomized them to the open label use of hydrocortisone or the 3-drug combination, vitamin C, thiamine, and hydrocortisone together. And in this study, as you see on the right, there's no difference in mortality. If anything, the intervention group is just a little bit higher, and also no difference in shock or vasopressor administration. But similar to some of the other studies, they did see a greater reduction in SOFA score at 72 hours for the treatment group. So about a 2-point reduction in SOFA score for the patients who received the 3-drug treatment compared to only a 1-point reduction in the patients who received the control group. And then finally, the ACT study, which was another study published very recently, conducted in the United States. In this study, there was the 3-drug combination tested in 205 septic shock patients, in the very similar regimen of vitamin C, thiamine, and hydrocortisone. And in this study, they found no difference in SOFA score. You see that in the top right. They both decline over time, but no difference between the two groups. There's no difference in organ function recovery, no difference in mortality. Again, if anything, on the panel that you see on the bottom right, mortality is slightly higher, but no statistically significant difference between the two groups. And they did see, in fact, a little bit more hyperglycemia and a little bit more hypernatremia in the patients in the treatment group. One other study to be aware of is the vitamin C, thiamine, and steroids in sepsis trial. This is the Victus trial. It was a prospective, multi-center, double-blind, adaptive randomization trial that was tested the three-drug combination in adult sepsis patients with either respiratory or cardiovascular compromise. And in this case, the study drugs the patients were allocated 1-to-1 to either placebo or to the similar regimen of vitamin C, thiamine, and hydrocortisone together. In this study, stress dose steroids were allowed at the discretion of the treating clinical team, particularly for those patients with septic shock. That's similar to other studies. The primary outcome in this study was ventilator and vasopressor-free days. In other words, the number of consecutive days alive and free of ventilator and vasopressor support in the 30 days after randomization. And the key secondary outcome in this study was mortality. So again, the eligibility for this study was sepsis and respiratory or cardiovascular dysfunction, or the two together. And the primary exclusions in the Victus trial were age less than 18, organ dysfunction present more than 24 hours, as patients were enrolled quite early through the emergency department and through the ICU admission process, if a patient had been hospitalized more than 30 days, or if they had chronic respiratory or cardiovascular organ dysfunction that would preclude the potential resolution with the treatment protocol. So the Victus study was conducted at 43 sites across North America. Over 3,000 patients were screened as potentially eligible for enrollment, and 501 subjects were enrolled. This study conducted follow-up out to 180 days, all of which is complete now, and the manuscript is in review and should be available to the public soon. So in conclusion, we know that vitamin C is very depleted in patients with severe forms of illness, severe forms of shock, including multiple organ dysfunction and septic shock. Individually, we've seen potential benefit with vitamin C and thiamine and corticosteroids in sepsis and in other critical illnesses. But the recent trials that we've seen, particularly with the three-drug combination, have suggested that there may be benefits, that some of the benefits have suggested a reduction in the duration of mechanical ventilation, reduction in the time of vasopressor use or septic shock, a reduction in SOFA score, and even potentially improved survival. The largest study to date, the Victus trial, is now pending and should be available, hopefully, for the public to view soon. But in the meantime, it seems that the heterogeneity of sepsis makes it less likely that this three-drug regimen is going to be effective for all patients. But pending further data, it seems worthwhile to consider it, particularly in maybe selected patients that we need to explore a little bit further. So I thank the organizing committee for the opportunity to talk today about vitamin C and sepsis, and encourage everyone to reach out and ask questions, or you can follow me on Twitter if there's something that you need. Thank you very much.